My name is Dr. Louisa and I make child health education videos. What typically is seen are the facial features. So individuals would have something that we call an epicanthal fold, which is an extra flap of skin that covers the inner part of the eye. Just a little bit of a flap of skin. The other thing that we see is a relative flattening of the nasal bridge in comparison to what you would expect, especially when you look at the mum and dad of the individual. You can also have features like a slightly webbed neck, so increased amount of tissue around the neck, and you can also have relative shortening of the back of the head. Other things that happen are that the mouth can be relatively small in comparison to the size of the tongue. We can also see things like finger differences, where you get an extra bit of a curve on the baby finger of the individual, or on the palm. Sometimes you see an unusual marking where instead of the normal pattern of palmar creases, you see a single line that cuts from one side to the other, what we call a single palmar crease. When you look at the feet, sometimes there's an increased gap between the first and second toes that is colloquially called a sandal gap. Babies with Down syndrome also sometimes have low muscle tone, so when you try and lift them, it feels as if their arms and their legs and their trunk are a little bit looser than you would expect. In terms of complications, some of the things that we are concerned about in children with Down syndrome is that difficulty with breathing when they're sleeping. Another issue that they can encounter is overweight. They can also have issues with hearing loss. This can be the result of repeated ear infections that are also happening because of the space in their mouth and the connections with their ears.